Bismillahirrahmanirrahim. Hello everybody. So this is the part second of the question number 35. As we already solved the question number 35, in which there is 35-year-old female patient came to us at 31 week of gestation. She having severe preeclampsia from which she developed HELP syndrome, which is hemolysis, elevated liver enzyme, low platelet count. So this is the part second of the question number 35. If you didn't watch the question number 35, go and watch the question number 35 part first, then watch the part second of the question number 35. So the part second states that the patient is admitted to the hospital and intravenous line and urine catheter are placed. She received corticosteroid to accelerate fetal lung maturity and magnesium sulfate for fetal neuroprotection. She developed dyspnea and a drop in arterial oxygen saturation 3 hours later. Her temperature is 36, blood pressure is 150 by 80 mm of Hg, and pulse is 112 per minute, and respiration are 24 per minute. The patient pulse oximetry show 91% on room air. Examination show by based crackles, use of accessory muscle for breathing, and 2+ pitting edema of the lower extremity. Otherwise, the examination is normal. Urine output is 60 milliliter per hour. What is the most likely cause of this patient respiratory symptoms? Amniotic fluid embolism, bronchospasm, magnesium sulfate toxicity, pneumonia, pulmonary edema, and pulmonary embolism. So first of all, this patient came to us at 35 week of gestation with severe preeclampsia. Now this patient developed severe dyspnea. And decreased arterial oxygen saturation. She uses accessory muscles to breathe. And her blood pressure is 150 by 80 mm of Hg, and urine output is 60 milliliter per hour. So what is the diagnosis of this question? The diagnosis of this question is severe pulmonary edema, because preeclampsia, the cause of severe pulmonary edema is severe preeclampsia, pulmonary edema. So here the correct option is choice E, pulmonary edema. Why the choice E? Because this patient's sudden onset dyspnea, hypoxia, and crackles are most likely due to acute pulmonary edema, a rare and life-threatening complication of severe preeclampsia. Preeclamptic patients have generalized arterial vasospasm, leading to increased systemic vascular resistance and high cardiac afterload. Additional factors that may contribute to pulmonary edema include decreased renal function and decreased serum albumin, and endothelial damage leading to increased capillary permeability. So the management includes supplemental oxygen, fluid restriction, and diuresis in severe cases. So here the correct option is choice E, pulmonary edema. Now come to incorrect one. Amniotic fluid embolism. So this patient is not in labor, so amniotic fluid embolism is not an option. Choice B, bronchospasm. So bronchospasm may cause dyspnea and hypoxia, but it usually causes wheezing instead of crackle and would likely be relieved by corticosteroid. C, magnesium sulfate toxicity. Excessive magnesium sulfate can cause neuromuscular depression. Toxicity is characterized by decreased respiratory effort, apnea, muscle paralysis, somnolence, visual disturbance, and decrease or absent deep tendon reflexes. Although pulmonary edema can occur from magnesium sulfate toxicity, the normal deep tendon reflexes and increased respiratory effort make this etiology less likely. Choice D, pneumonia. Pneumonia in a pregnant patient can cause crackles and dyspnea, but is usually accompanied by fever. It would not cause lower extremity edema. Choice F, pulmonary embolism. So the risk for pulmonary embolus is increase in pregnancy due to increased thrombotic effect of estrogen. However, in the setting of severe preeclampsia, crackles and peripheral pitting edema, pulmonary edema is most likely. Now come again to the choice E. Why the choice E is a recurrent pulmonary edema? Because this patient age is 35 year and she is in severe preeclampsia. So the cause of severe preeclampsia, the cause of pulmonary edema is in this patient is severe preeclampsia because this patient developed dyspnea and decreased arterial oxygen saturation, and she uses accessory muscle to breathe. Her blood pressure is 150/80 and urine output is 60 milliliter per hour. So this patient developed pulmonary edema from increased vascular resistance and also from decreased albumin concentration. So due to hydrostatic pressure and oncotic pressure, this patient developed pulmonary edema. So here the correct option is choice E.